The following is a list of efforts to repeal the Affordable Care Act, which had been enacted by the 111th United States Congress on March 23, 2010. A January 9, 2017 Congressional Research Service report entitled, Legislative Actions to Repeal, Defund, or Delay the Affordable Care Act, noted that since ACA was passed in 2010, Congress has been deeply divided over the ACA. Lawmakers opposed to specific provisions in the ACA or the entire law have repeatedly debated its implementation and considered bills to repeal, defund, delay, or otherwise amend the law. Quote, in October 2013, there was a partial shutdown of government operations that lasted over 2 weeks because of a disagreement between the Democratic-controlled Senate and the Republican-led House over the inclusion of ACA language in the FY 2014 temporary spending bill. In 2011, after Republicans gained control of the House of Representatives, one of the first votes held was on a bill titled, Repealing the Job-Killing Health Care Law Act, which the House passed 245 to 189. All Republicans and 3 Democrats voted for repeal. House Democrats proposed an amendment that repeal not take effect until a majority of the senators and representatives had opted out of the Federal Employees Health Benefits Program. Republicans voted down the measure. In the Senate, the bill was offered as an amendment to an unrelated bill, but was voted down. President Obama had stated that he would have vetoed the bill even if it had passed both chambers of Congress. Following the 2012 Supreme Court ruling upholding ACA as constitutional, Republicans held another vote to repeal the law on July 11. The House of Representatives voted with all 244 Republicans and 5 Democrats in favor of repeal, which marked the 33rd partial or whole repeal attempt. In January 2013, Republicans introduced an act to repeal the Patient Protection and Affordable Care Act in the United States House of Representatives. Strong partisan disagreement in Congress prevented adjustments to the Act's provisions. However, at least one change, a proposed repeal of a tax on medical devices, has received bipartisan support. Some congressional Republicans argued against improvements to the law on the grounds they would weaken the arguments for repeal. Republicans attempted to defund its implementation, and in October 2013, House Republicans refused to fund the federal government unless accompanied with a delay in ACA implementation, after the president unilaterally deferred the employer mandate by 1 year, which critics claimed he had no power to do. The House passed 3 versions of a bill funding the government while submitting various versions that would repeal or delay ACA, with the last version delaying enforcement of the individual mandate. The Democratic Senate leadership stated the Senate would only pass a clean funding bill without any restrictions on ACA. The government shutdown began on October 1. Senate Republicans threatened to block appointments to relevant agencies, such as the Independent Payment Advisory Board and Centers for Medicare and Medicaid Services. On February 3, 2015, the House of Representatives added its 67th repeal vote to the record. This attempt also failed. The House passed the Restoring Americans' Healthcare Freedom Reconciliation Act of 2015 on October 23, 2015 under the FY 2016 budget reconciliation process, which prevents the possibility of a filibuster in the Senate. The bill would have partially repealed the provisions of the Affordable Care Act, notably the individual and employer mandates as well as the taxes on Cadillac insurance plans. Some conservatives in both the House and Senate opposed the bill because it did not completely repeal the Affordable Care Act, which would have been inconsistent with the rules governing budget reconciliation bills. The bill was the 61st time that the House had voted to fully or partially repeal the Affordable Care Act. The bill also would have removed federal funding for Planned Parenthood for 1 year. The bill was expected to be vetoed by President Obama should it pass the Senate. In early December, the Senate passed an amended version of the Healthcare Reconciliation Bill, sending it back to the House. It was passed by the House on January 6, 2016, and vetoed by President Obama on January 8. the sixth veto of his presidency. The House failed to override the president's veto on February on a vote of 241 to 186, which did not meet the required two-thirds supermajority. In January 2017, the Congressional Budget Office submitted its report on the estimated impact on insurance coverage and premiums with the repeal of ACA through H.R. 3762. The Restoring Americans' Healthcare Freedom Reconciliation Act of 2015. The report, completed with input from the Joint Committee on Taxation, estimated that 18 million more people would be uninsured in the first year after the repeal, and by 2026, the number would rise to 32 million. 1 for those who were